Hello, everyone. My name is Tim Appleton, the Eastern Field Director for Compassionate Choices, and I'm going to be your moderator today. Thank you for joining our webinar billed as Opportunities to Expand Telehealth Use Amid the COVID-19 Pandemic. As the title of our presentation underscores, we're going to be highlighting how telehealth can be used to ensure access to end-of-life care. Compassionate Choices, as you might know, is the nation's oldest, largest, and most active nonprofit working to improve care, expand options, and empower everyone to chart their own end-of-life journey. I'll be joined today by Sylvia Trujillo, Compassionate Choices Policy Director and Legislative Counsel, who joined us this year after 13 years with the American Medical Association, where she focused on advancing the integration of telehealth into widespread practice. And also Anthony Hinojosa, the Compassionate Choices Federal Manager, who formerly worked on Capitol Hill. Just like the other programs in our Stronger Together series, we're going to be recording this webinar and we'll post it as a resource on the Compassionate Choices website. To ask a question at any time, type your question into the Q&A box on your screen and click send. We will answer as many questions as we can at the end of the presentation. Today, our presentation will cover the immediate impact of COVID-19 on those with a serious or terminal illness, Compassionate Choices work since March to advance equitable and access to end-of-life options through quality telehealth, some foundational topics including what is telehealth, and then our work at the state and federal level to advance access to telehealth during COVID-19, including what we've accomplished, what we'll be doing to remove the barriers too many individuals with serious terminal illness face when accessing end-of-life care, medical services like hospice and palliative care. And now I'd like to turn it over to my colleague, Anthony Hinojosa, our federal manager. Anthony?
Thank you, Tim. Next slide, please, sir.
Anthony, give me a moment here. I'm stand by. Oh.
There we go. Great. Thank you, Tim. In the early days of the pandemic, our seriously ill and terminally ill supporters began expressing deep-seated concerns that they were vulnerable to contracting the coronavirus and dying prematurely. A compassionate, pain-free death was no longer possible given healthcare shortages, and they might die alone, suffering, without access to hospice and palliative care to ease their pain. For Compassionate Choices, this was a call to action. Although we could not directly affect the trajectory of the COVID-19 pandemic, we knew we could play an important role safeguarding access to hospice and palliative care during this most challenging time. The question was, given the massive demand being placed on our healthcare system and the anticipated shortage of healthcare professionals, what could be done? Next slide, please. First, we understood that individuals needed the tools to ensure that their wishes were known if they were diagnosed with COVID-19. We promoted awareness and access through the Compassionate Choices My End of Life Decisions Guide. It helps you to work through your end of life priorities and empowers you to have meaningful discussion with your family and healthcare providers. The toolkit includes forms for advanced care planning that can be supplements to your advanced directive. In addition, our website links you to state-specific advanced directives. Next, our Finish Strong, Putting Your Priorities First at Life's End, a thorough, informative, and engaging guide to achieving the positive end-of-life experience you want and deserve. We also highlighted the Dementia Values and Priorities tool, our newest online resource that helps you pre-claim your voice so a healthcare proxy can carry out your wishes should dementia take hold. But we knew that more was needed. By early April, we issued the COVID-19 toolkit, including information on COVID-19 treatment options, advanced directives, and using telehealth in the time of COVID-19. These materials are available in both English and Spanish. But even before then, in mid-March, we launched federal and state advocacy to ensure continued access to hospice and palliative care through telehealth and other virtual services. Before I turn it over to our policy director, Sylvia, we would like to do a quick poll that should pop up on your screen. the poll question is asking you, how familiar are you with telehealth? A, very familiar, B, somewhat familiar, or C, not familiar at all? Please click your answers in the box on the screen. We're going to take a few seconds to allow everyone to answer. We definitely appreciate everyone being on today. These webinars that Compassion and Choices have been doing are really, really amazing and are allowing us to really showcase the work that we're doing and the work that we're doing to help everyone across the nation in this very, very trying time. Let's just give the question a few more seconds. And I believe we have those poll results. Here they are. It looks like some of us know about telehealth and some aren't so familiar. Sylvia, would you mind telling us more about this, please?
That's great, because it turns out that if you've seen one definition, Anthony, of telehealth, you've seen one definition of telehealth. There are many by state and federal regulators and payers, and folks use the terms also telemedicine or digital health. And depending on who you're talking to, this term can mean audio-only telephone, email, interactive video, or it could also include something called remote patient monitoring, which can be used to monitor your vital signs like blood sugar, weight, and arrhythmia. It could be uploaded and sent to your healthcare clinician. When Compassion and Choices uses the term telehealth, we typically mean two-way audio, visual, interactive communications between you and your clinician so that you can receive your healthcare services from home or the location of your choosing. Next slide, please. So, how is it a solution? It turns out that 9 out of 10 physicians, even prior to COVID, recognized the benefits of telehealth. 2/3 of the physicians indicate that virtual care improves patient access. More than half recognize it improves patient satisfaction. But prior to COVID-19, adoption rates had been actually pretty low, though rising. Why? Restrictive federal and state laws and policies. So here at CNC, we knew that telehealth presented the fastest and easiest way to ensure that individuals with a serious or terminal diagnosis could receive the best possible care in the safety of their homes during the pandemic. One, because clinicians are able to deliver pain management remotely. Quarantine providers are able to continue to safely practice, which means access for end-of-life care. And clinicians in other states can help mitigate the healthcare providers in those areas where there are surges. The current global crisis notwithstanding, people are still dying from diseases like cancer, and you need access to healthcare to avoid premature and painful deaths if you have a serious disease or a terminal condition. Next slide, please. Compassion and Choices identified specific policies needed to advance rapid telehealth adoption, and then we prioritized those that would ensure continued access to hospice and palliative care services, including policies that would remedy structural inequality for underserved communities. While there are many policy changes involved in transforming clinical practice, we focused on those designed to modernize federal and state regulation and to expand payment among government-funded healthcare programs and commercial healthcare insurers so that we can very easily expect to access those when we need those services from our clinicians. Burdensome regulation and lack of payment have limited provider willingness to offer these services, and this deprives individuals who have a terminal diagnosis from the ability to get these when they need them. So let's move to the next slide, please. So let me go over a broad overview of some of the advocacy that we did at the federal and state level, and sort of level set though. So the next slide outlines that, not surprisingly, in the month of March and April, as you all well know, an unprecedented number of actions were taken by federal and state leaders to try to mitigate the spread of COVID-19. The public health emergencies were declared at the state level by the federal government, in U.S. territories and the District of Columbia, along with many other state government-led actions. Next slide, please. It's within this context that CNC really activated our work. In the second week of March, we evaluated what was needed to ensure individuals with a serious or terminal condition would have continued access to palliative, hospice, and other medical services. We forged new alliances with key stakeholders like the ATA, the Alliance for Connected Care, the Connected Health Initiative, to join forces with them to do both federal and state-based collaboration. And they provided us with really critical additional expertise. We submitted to congressional leadership 3 letters, 2 that were initiated, drafted, and prepared by Compassion and Choices. We joined sign-on letters, and these outlined innovations in care delivery that emphasize the ease of access and advanced equity. A number of the provisions we advocated for were included in the final CARES Act, including changes to the Medicare program, which covers the services of large numbers of individuals with a serious or terminal condition. The CARES Act, Anthony will go into, was one of the rescue packages. So for example, what does this mean for you and me? For those who are Medicare beneficiaries, this means hospice recertifications can now be conducted via telehealth by nurse practitioners as a covered service. It means that palliative services can now be delivered remotely for patients without prior restrictions that existed on whether you could get it at home or whether you had to be in a remote location. And now rural health clinics and federally qualified health centers have access to telehealth, and there are a whole range of additional flexibilities. So I'm going to hand that now over to Anthony in the next slide so he can outline some of the additional work that we undertook. Anthony?
Next slide, please, Tim. Thank you, Sylvia. That was very informative and an amazing amount of information for people to understand how telehealth works and the work that we've been doing. We're always monitoring policy changes that can disrupt patient-directed care, as this pandemic has brought about many new policies. Most notably, we caught a waiver buried in a flurry of announcements. The Center for Medicare and Medicaid Services issued a temporary waiver to the Patient Self-Determination Act of 1990. This law recognizes and establishes the importance of patients being able to determine the treatments they receive at the end of life. This waiver could result in some patients receiving unwanted medical treatment and others not receiving treatment they want and critically need. Compassion and Choices sent a letter to Congress and Health and Human Services Secretary Alex Azar urging him to rescind the waiver. We then initiated a sign-on letter joined by 12 national organizations and 5,000 individuals who were supporters of Compassion and Choices. In the letter, we recommended that HHS urge all Medicare providers to reach out to their patients using telehealth and prepare advanced directives. Next slide, please, Tim. We are also advocating for changes on the state level to improve the delivery of healthcare via telehealth, given that much of the practice of medicine is regulated by the states. Next slide, please, Tim. State legislatures adjourned, with many anticipating special sessions at the end of summer to address concerns surrounding COVID-19. But governors issued special orders in the meantime. In less than 45 days, executive action by governors moved at a very rapid pace. Next slide, please. Staff at Compassion and Choices contacted decision makers in over 40 states, including governors and prominent legislators, with 4 major recommendations in coordination with other stakeholders. We joined a chorus of leading organizations in the telehealth space, reinforcing steps needed to advance access to hospice and palliative care via telehealth. We added CNC to a sign-on letter to the National Governors Association, urging a number of regulatory and payment changes to facilitate access. As a result of this quick action, Oregon provided a clarification on e-prescribing. California and Hawaii added clarifications that telehealth is permitted within their states. We will continue to reach out to other states with these letters to ensure that we are getting the same levels of response that we are receiving in Oregon, California, and Hawaii. Next slide, please. At the federal level, we're writing signature federal legislation seeking to extend and make permanent a number of telehealth flexibilities authorized by Congress, as well as other provisions to aid patients at the end of life. At the state level, we look forward to supporting and encouraging state lawmakers around the country to improve access to end-of-life care via telehealth. Next slide, please. I would like to thank everyone who has joined us today on this very important topic. I would like to turn the presentation back over to Tim for Q&A and closing remarks. Thank you.
Thank you so very much, Anthony. I know we have a number of people joining us today for our presentation. We do have some questions here for you both. Would you mind answering some questions for us, you guys?
Absolutely.
Thank you very much. Anthony, I have a question for you. You have a lot of experience up on Capitol Hill. Do you expect Congress will pass laws to make telehealth expansion permanent? And the follow-up would be, how do I express support for the use of telehealth for hospice and other end-of-life care?
Thank you for that question. It's very good and poignant in this time. I would hope that Congress can get together and make these telehealth provisions permanent. It's going to take a lot of work on our end and a lot of our partner organizations that we've been working with. Sylvia mentioned some of them in the presentation, but we know that there's right now a coalition of about 30 or 40 members of Congress who really see these as important steps moving forward out of the COVID-19 pandemic. We're excited with our federal legislation to be pushing for this to be a permanent healthcare addition moving forward. So we're really, really excited working with the team, working with Sylvia to push these policy options onto Congress and ensure that they do get passed. The best way to express your support of telehealth, you have a couple of options. One, write a letter to your member of Congress. I know that our digital teams here at Compassion and Choices do a great job sending out action items where they're ask you to tell your member of Congress that you support this or you support that, or we don't support them doing certain things. And we really do a great job. But you know what, reach out to us at CNC and ask us, oh, you know, is there some sort of standard language that we can use or a prompt that we can use? And we'll definitely get that out to you and let you start hitting up your members of Congress on your own. The second is, earlier in the year, we actually mentioned this letter that we had 5,000 individuals sign up for. We foresee doing that more in the future, and we will definitely let everybody know to add your name to things that Compassion and Choices feels are important. So those are definitely two ways that you can help out with that.
Oh, thanks, Anthony. Sylvia, I have a question for you as they keep rolling in here. Is telehealth honored by all insurance? Do you know?
So unfortunately, there's not a standard answer to that question. It turns out that there are federally funded healthcare programs like Medicare or Veterans Health Administration. If you're a vet, you are going to be in luck because telehealth is covered quite extensively in the Veterans Health Administration. In Medicare, as a result of COVID-19, there's been a pretty significant expansion in telehealth coverage and payment. And in many states where most commercial private plans that many of us have who are not eligible for Medicare or state-based programs like Medicaid, we get our health insurance coverage there. While there's been also an expansion amongst commercial payers, it hasn't always been consistent. It hasn't been across the board. And so it's really important for you to contact your insurance company to find out what services that they'll cover, and then check with your provider to also ensure that they're offering those services.
If I may ask a follow-up to this, do you see that changing over time a little bit, Sylvia, as COVID-19 kind of bears these healthcare disparities and technology moves forward?
I'm really glad, Tim, that you brought up the issue of health disparity. So there's two questions embedded in there. So the first is absolutely consistent with what Anthony just shared. There's major coalitions like ATA, the Alliance for Connected Care, the Connected Health Initiative, that have been working for a really long time, along with, quite interestingly, nursing associations, physician associations, the hospital association. There is a really strong alignment around COVID-19 and the national pandemic to support increased access to virtual services like telehealth and remote monitoring. And we fully anticipate that the evidence is rolling in to support some of those expansions to be made permanent, because they do provide a way to overcome some of the structural inequality that can occur when you can't take time off from work. You're an hourly employee. You're in a geographic area where there aren't many specialists who can provide your care, or the transportation costs are so prohibitive for you to get to your care that telehealth removes all of those barriers. And so it's a really sensible approach. And from our perspective, when you're talking about individuals who are end of life that have a terminal diagnosis, a serious diagnosis, having to go in person to receive your care is not only difficult, but it could adversely impact your already fragile health status. And so we are going to be gathering the evidence. There is already a substantial evidence base, but further augmenting it so that we can go to Congress and go to state policymakers and to commercial payers to make the case for permanent adoption of these policies to improve access.
Thank you, Sylvia. It's very informative. Anthony, I have a question for you from our attendees today. What's the status of the response letter about reversing the waiver? Has there been any updates you could share with us on that?
Unfortunately, that we have not received an answer from Secretary Azar requesting that they rescind the waiver, but we do know that it is only temporary during the COVID-19 pandemic. But we are hoping, given everything else that they have going on right now, that HHS will take heed to the letter and rescind the waiver sooner rather than later.
If I could also add to that, Tim, there's not only an opportunity for policymakers to make a change here. Turns out that the Medicare program, as a result of COVID-19, authorizes the use of telehealth for the purposes of advanced care planning. So all of you, especially if you're a Medicare beneficiary, you can contact your provider and indicate that via telehealth you would like to set up an appointment to do advanced care planning. And this is a covered service under Medicare. And by the way, you don't have to go to your physician's office. This is a covered service under telehealth. And so in addition to you reaching out to your physician to have this conversation, there are other stakeholders who are actively encouraging other commercial payers to cover these services as well. So beyond the federal government doing something, there's steps that we can take to actually accelerate the widespread adoption of advanced directives.
Yeah, I'm sorry, may I build on that too, Sylvia, if you wouldn't mind? I mean, we have, although Compassionate Choices doesn't put out its own advanced healthcare directive wallet card, we do have a ton of great resources on our website to help you put one together. Like I said, we don't have a wallet card, but you can save your advanced healthcare directive on your phone. You can share it with your medical providers, healthcare proxy, and members of your family. Make sure it's like easily accessible. You can put it in the glove box of your car. I know people that use a magnet and put it on the refrigerator. So making sure that people know that you have an advanced health care directive and having it easily accessible is so critically important. Wouldn't you agree?
It is, and I'd like to pivot back. I mean, I think this is an area that matters clearly based on the questions to the folks that we have the mission of helping to amplify your concerns and your issues, that the policy that the the administration has advanced around a waiver for the hospitals, I think underscores the opportunity we have to have our voices heard by preparing our advance directives, advocating for policies to ensure that they're honored. So it's really important in the time of COVID-19 that you not only put those advance directives in place, but that you carry them with you and your family knows where they're at. And I just do want to give a shout out to Governor Cuomo and the governor of California, who have considered important waivers. And in the case of California, it's under consideration, but important waivers that would remove impediments to you being able to virtually complete and put in place advanced directives. And so we hope to see the use of virtual services, not just in the delivery of healthcare services, but in the process of putting together legally enforceable advanced directives.
Thank you, Sylvia. Here's another question to you, Sylvia, about telehealth and the recommendations we made at the state level. You and I work very closely on this together. Can you talk about the recommendations we made, please?
Yeah, and I think, Tim, it would be great if you can pivot around some of the conversations that you had. So first of all, we actually collaborated with a lot of different stakeholders in identifying those very specific state-based recommendations, and there were 4 broad ones. The first was around licensure. We have a situation where you have to be licensed in the state where the patient receives the services, and this means that physicians and nurses licensed in other jurisdictions during the surge would not necessarily be able to provide services via telehealth. And so the Federation of State Medical Boards, the nursing boards, ATA, and several other alliances got together and they advocated for standard reciprocity that would allow a clinician in good standing in other jurisdictions to be able to practice in a state, particularly where there's a surge. And so executive orders were needed in states in order to make that happen. So one of our major recommendations was please help put into place policies that would allow for that reciprocity to occur during the pandemic, and also to make sure that within a state we were using all clinicians who were duly licensed, like nurse practitioners, like PAs, like pharmacists, at the top of what we call their license, meaning that they're able and authorized to get paid and to provide services for things like testing and administration of vaccinations. And that really segues into our second recommendation, which was concerning pharmacists, that we really felt like even though they're licensed to provide many services, they're not always paid for those services by state healthcare programs and commercial payers. And so we urged for those state healthcare programs that their services be covered so that clinicians who are handling the surge and are now not able to provide care to individuals with end of life needs, like cancer and other very serious conditions, that services could be provided in a community based setting, easily accessible, and where individuals would be less likely to exposure to COVID-19. And our other major recommendation had to do with pain management. Individuals with both either palliative care needs or hospice care needs. Controlled substances flexibilities were offered at the federal level by the DEA, which said that the in-person evaluation for your pain medication could be done through interactive video. Unfortunately, there were and are some state laws that mimic the federal law that say it has to be in person. So even though the federal government said you could do them interactively, we needed the governors and or legislatures in states to say, we also are extending a waiver to allow interactive video so that controlled substance pain medication could be prescribed using an evaluation that's done through the telehealth mechanism. So those are some high level recommendations, and we had some additional ones embedded in there.
Right. And as we were creating the letter that would go out to the lawmakers, there were a lot of great resources that these other institutional partners put forward about which state had what, and there was a map that we were closely working on. I'm sure you remember. And what we found was even some states that identified themselves as, oh, yep, we have everything we need under the pressures of this terrible pandemic, you know, they found that it wasn't as good as they thought they had. Correct, Sylvia?
Right. I mean, we had some really great examples where stakeholders on the ground said, you know, we have done the full panoply of policy changes from licensure to, you know, insurance, both private and public plans covering services around prescribing and controlled substances. And many of them had, but once we started digging in and looking through all of the executive orders and the laws that they had on their books, we did find gaps. And I suspect, you know, there are 50 states, the territories, and the District of Columbia. Those were the ones that we could very immediately identify where there were deep dives. But it underscores that it really depends on what state you're in, and our advocacy in cooperation with these national organizations like ATA and the Alliance and other experts was really helpful in bringing our shared voice to say hospice, palliative care, end-of-life services become inaccessible during a surge situation unless you have access to virtual services. And that was our goal, to address both the federal and state impediments and to support those changes that were needed.
Yeah. Thank you very much, Sylvia. Hey, Anthony, can I ask you a question too? I have one here for you.
Absolutely.
Thanks. One of our listeners is asking, can I add my signature to this sign-on letter to express my concern that the government is not requiring hospitals to let me know I can prepare an advance directive?
So at this point, that letter has already been sent to Secretary Azar, but we do foresee adding, doing more letters and continuing to make this push. So there will be more opportunities for people to add their names and let their voices be heard on this very important issue.
Thank you, Anthony. I appreciate that. Sylvia, here's another really good question for you. And it's a powerful one. I need pain medication refills, but my doctor says I have to go in person for a refill. Is that true?
Well, it depends on what state you're in. So I think earlier on I shared that if you were receiving a pain medication that is a controlled substance, that's regulated at both the federal and state level, and the Federal Drug Enforcement Agency requires an in-person evaluation when prescribing certain controlled substances. And so they took steps in March to waive that requirement, not altogether, but to allow for interactive video. So I want to be really clear, it's not audio only telehealth. It is an interactive video with you and your prescriber. But again, some states have on their books that they too, like the federal government, require an in-person evaluation before that prescription can occur. And as a result, we had to advocate that the states take action either through executive order or legislative action, which, as Tim noted, would have been very difficult. So through executive order, to waive that requirement and to permit interactive audio-visual. Having said that, not all clinicians are set up to do interactive video. So while even if it's permitted in your jurisdiction, it's going to be really important for you as a patient to share your expectation that your clinician do their best and make a strong commitment to virtual services. Physicians and other clinicians are, I think, really rethinking their thoughts about whether or not they can only deliver care through brick and mortar, physical in-person evaluations, what they are finding is that these services can be a quality experience, quality care delivered, that they're efficient, and they remove many of the impediments that can worsen care or result in a bad outcome for their patients. So the critical part is to ask your physician whether or not it's based on the state law or if it's really a decision by the clinician not to offer that service in that modality.
Thank you, Sylvia. Let's see, I have another question here about telehealth. How do I find out if my nurse practitioner uses telehealth or is allowed to in my state? Sylvia, is that just having a conversation with your healthcare provider, or, like that? I'll let you answer.
So you're exactly right. The first question you all should put to your providers are, one, do you offer telehealth? And if you don't, is it because there are laws at the state level that impede adoption, or is it instead just a limitation or preference of the practice? I do have to say that many practices, as a result of COVID-19, have as a critical continuity need adopted telehealth because so many in-person appointments have been canceled. The other question revolves around nurse practitioners, and I just want to be clear that the Medicare program, for instance, and other commercial payers oftentimes can limit who they will cover, which one of your healthcare professionals they will pay for you to receive a service or for you to receive the service via telehealth. And the great news is, if there is great news or any silver lining to COVID-19, is that it's underscoring the need for virtual services. And so now is the time to ask these questions and reach out to your healthcare professional to get those questions answered.
Yeah, that's a great point, because it is patient-directed care, right? That's what we're striving towards, and why, as an organization, Compassionate Choices is, working so hard in this space. Correct, Sylvia?
That's right.
Yeah, thanks. I think we might have time for one or two more questions here. Sylvia, what happens if my doctor is in another state and I normally go in person? Can I receive care from her via telehealth? I live in a city near a border.
So again, you first want to ask her. That's always going to be our fallback, but just keep in mind that many physicians and other clinicians near a border, turns out nurses have really great reciprocity compacts. So this is especially apt for them, where they have a license to practice in both jurisdictions. But as a result of COVID-19, many jurisdictions that have cities that sit on or near borders have entered into agreements or executive orders have been issued by their state to allow clinicians of good standing in other jurisdictions to practice in another state. Now, there are requirements, so we're urging providers and clinicians, depending on whether they're a nurse or they're a physician or some other professional, to check with the state's licensing board or the federation or organizations that represent boards, like the Federation of State Medical Boards, that has a listing of all the requirements that apply with regard to flexibilities for out-of-state licensed clinicians that may want to provide telehealth in an impacted state.
Thank you very much. I think those are the questions that we have now. And Sylvia and Anthony, would you like to add anything else that came up through the Q&A? Fill in any spots you might find? opportunity for you.
So Tim, there's a question though for you, and it's a one that is really, I think, commonly posed to us through this process. And both you and Anthony may want to share your views on this, but the question is, Compassionate Choices focuses on end-of-life care. So why is the organization spending so much time advocating around telehealth and virtual services from your perspective at the state level, and Anthony, the federal level?
I think that's Anthony, I'll let you go first.
So at the federal level, we feel that this is the way for the work that we do at Compassionate Choices to be magnified. We can show people, yes, that Compassionate Choices deals in all end-of-life care options, and we can continue to help people even in this crazy time of COVID-19 to get the care, get the access that they need if they have a serious illness or a terminal illness, and really receive the end-of-life care that they want, and can really control their outcomes at the end of life.
Yeah, I agree with you 100%, Anthony, and would only add that one of the reasons that many of the supporters that I work with on a daily basis, they're very, very, motivated by having autonomy, through the aging process and at end of life. And whether it's through telehealth, so they don't have to, as one of the questioners asked, it would be great to not have to go to the doctor to get a simple refill, all the way out to, during the last days of my life, this is the way that I want to order them. So it's for those reasons and more that, we're doing so much in this space. And as Anthony rightly said, the pandemic and the loss associated with it, and that people were, we all saw it, and perhaps some of us on this call experienced it as well. Having a loved one die alone in a hospital, that's a horrifying example of a terrible situation. So I think for those reasons and more, that's why we're working in this space as well. Sylvia, do you have anything to add?
I do. It's this idea of patient-directed care, patient control in their care, and really democratizing the space and time in which you can access your care is an essential component. And end of life should not be a series of trucking with the last bit of energy and strength you have to a doctor's office or a hospital, but it should really be receiving the care in a way that is easiest for you and your family and loved ones, and allows you to incorporate them in the care to the extent that you desire that. It also is really important to address some of the structural inequality that many communities face when they try to access end-of-life care. Pain management is a classic example, and telehealth can be, if it's thoughtfully deployed, a great equalizer and improving of the quality of care for end of life.
Yeah. Thank you so much for that thoughtful answer, both Anthony and Sylvia. There's one last one here, and maybe it's for me. How do you get involved and volunteer with Compassionate Choices? Maybe I'll start this off, and I'll let you answer as well, Anthony and Sylvia. But I mean, the first step is to go out to compassionandchoices.org and sign up for updates and say that you're interested in volunteering by checking the boxes there. You'll get a whole host of emails back with some very specific instructions to plug you in to people on the ground, like many of my colleagues that are working every day to improve care and expand options at end of life. The answer to the question, in my view, is just let us know that you're interested, and we will plug you in, because we need the help for sure. Sylvia or Anthony, do you have anything to add to that?
Yeah, absolutely. I would say be sure that you're participating in all of our webinars. Tim's going to be talking about the ones that are upcoming. They're all available. The past ones are available on the website. Tim will also be talking about that. let us, and like Tim said, let us know that you're available and actively participate in these really great issues that we're bringing forth to the public.
Well said.
Yeah, we have a national volunteer program that's very robust and will connect you in your state to the right people, as well as to the federal work that Anthony's doing every day. That's a great question, and thank you for asking it. With that, I think we're going to close out the question and answers and go on to some next steps, if that's okay, everybody. Let me advance this slide here. There we go. Thank you for your patience. You can find all of these resources like the Plan Your Care tool, Finish Strong tools, the COVID-19 toolkit, and more are all available on our website at compassionatechoices.org/end-of-life-planning. All of these are available as well in Spanish language version. We're very proud of that. Next slide is upcoming webinars in the CNC Staying Stronger Together series are available as well. Here are those. The first one is on Tuesday, June 9th. This is a town hall, how the COVID-19 pandemic is changing end-of-life care, the clinical perspective on the good, the bad, and the way forward. There's another great one on June 16th. You see the times there, 3 p.m. Eastern, becoming a powerful virtual advocate, how your online presence can inspire action. And the next one is on June 25th. This is a Ask Me Anything, a conversation with Compassion Choices end-of-life care consultants. We update this list all the time. And as you see at the bottom, for more information, you can go out to compassionandchoices.org/webinar series. Advance these slides here for us. To view the recordings from the previous Stronger Together webinars, you can visit compassionandchoices.org webinar series. The past sessions have included our webinar about National Healthcare Decisions Day. We had a town hall for that. We also had the part 1 of the Become a Powerful Virtual Advocate. There's also National Healthcare Decisions Day End-of-Life Decisions Guide Toolkit with Diane Rehm and Charting Your Own Personal Journey. This is hosted by the Raven Group. Living and Dying with Dementia, Taking Charge of Your Personal Values, hosted by the American Society on Aging. We also had a webinar, a great conversation about grief and loss, which was very good as well. What Does It Mean to Finish Strong was a webinar series with Barbara Coombs-Lee, who is the author of the Finish Strong book. Medical Aid in Dying Across the States. This was a webinar. Part 1 was conducted and is available to view. Also, the Medical Aid in Dying, Ensuring Terminally Ill People Can Access the Law, Part 2 of 2. And then finally, we had a webinar, Engaging Communities of Color, Ensuring All Americans Are Prepared for the Inevitable End-of-Life Journey. So the next slide references all the places you can go online and join us together, including Twitter, Facebook, YouTube, and we even have an Instagram account now, which is great. So you can join us and continue the conversation there. And then finally, Compassionate Choices, as many know that are on this call right now, is funded almost exclusively by individual donors like you who are committed to issues of end-of-life care and choice. Please consider making a donation today to help us expand our work and ensure that everyone's priorities and values are met at end of life. Every donation of any amount makes a difference, as those donations allow us to continue improving care and expanding options at end of life. If you enjoyed the presentation today, please consider making a donation that we can bring similar presentations to others. You can go online to our website right now at compassionatechoices.org/donate and donate online. Thank you very much. That's our presentation, but before we go, we have one more poll question for you. And if you wouldn't mind putting that up, did you find this presentation informative? Very informative, somewhat informative, or not at all informative? The feedback here is very important to us as we improve programs like this one in the future. Thank you so very much. Please take the poll, and we appreciate your time today.